No, I don't know.
Hi, and welcome to Navigating Medicare, hosted by Acromegaly Community, with special guest Emily Brown with the PAF Foundation. I'd also like to take a moment and thank our sponsor, Amaret Pharmaceuticals. Without your support, this program would not be possible. Emily?
Thank you so much, Jill. I'll go ahead and share my screen and we can get the presentation going. Hello, my name is Emily Brown. I'm the Patient Education Content and Project Manager with Patient Advocate Foundation. I have been with PAF for over 9 years, and I am really happy to be able to be speaking with you on the topic of Medicare and enrollment. A quick history of PAF. Patient Advocate Foundation started in 1996 with a volunteer staff of 2 and served 150 patients that first year. Cut to 25 years later, and we have a full-time staff now of over 200 employees, and we've directly assisted over 1.7 million patients. Our foundation was started by Nancy Davenport Ennis and her husband, Jack Ennis, in honor of their dear friend and breast cancer patient, Cheryl Grimmel. They were inspired to advocate for patients after Cheryl experienced hurdle after hurdle while trying to access care for her breast cancer in the 1990s. After getting halfway through treatment, she was getting a bone marrow transplant. She found out the procedure was not covered by her insurance company. And Nancy and Jack knew that they did not want another patient to go through what Cheryl had experienced, fighting for her life and her insurance company. So on the night of Cheryl's funeral, they wrote the business plan for Patient Advocate Foundation. And just a quick breakdown of our different areas of engagement and the services that we provide to patients. PAF assists patients in a multitude of ways. Our case management services are provided at no cost to patient or the point of contact. Patients can have any insurance status, age, gender, any ethnicity or cultural heritage, any employment status. Patients can also reside in any part or state in the U.S. or U.S. territory, have any income range, including no income, and can be diagnosed or screening for a broad range of diseases and diagnoses. Last year alone, we served patients with almost 750 different diagnoses, and that's including 330 rare diseases. Our copay relief program assists patients with diagnosis-specific funding to pay for copayments, and when funding is available, we do offer acromegaly copayment assistance. Through our financial aid funds, we administer small grants directly to patients to help them cover non-medical expenses like transportation, food, and housing. That's also diagnosis-based assistance. PAF's education initiatives provide actionable advice and guidance to patients, caregivers, and healthcare professionals with a range of topics in a variety of formats. We have webinars, healthcare, interactive training, written publications, podcasts, animation, and more. We also offer a Scholarship for Survivors program that grants scholarships to patients who've been treated for life-threatening diagnoses in the past 5 years. And those scholarships are available to graduate and undergraduate students. So we will be discussing today the different parts of Medicare, the enrollment process, how to choose a plan, and considerations acromegaly patients need to take when choosing coverage, as well as how to use your Medicare coverage once you have it. Diving right in. So what is Medicare? Medicare is the federal health insurance program that began in 1965. It's overseen by CMS, which is the Centers for Medicare and Medicaid Services, and that is a department of the Health and Human Services. So Medicare insures people 65 and older, people younger than 65 that have been deemed disabled by Social Security, and people with end-stage renal disease who need dialysis or require a transplant, as well as people with ALS who have been deemed disabled by the Social Security Administration. Medicare is paid through 2 trust fund accounts with the U.S. Treasury that are only used for Medicare. The funds for Medicare are acquired by different sources, including employee and employer payroll taxes, income taxes on Social Security benefits, premiums paid by beneficiaries who are receiving Medicare, and funds authorized by Congress. We have these conversations and we talk about Medicare as if it is one thing, as if it's one big entity, but it is actually many different things. So Medicare is broken up into different parts of coverage, including hospital, medical, and prescription coverage. And original Medicare, which is what we'll focus on mostly tonight, includes Medicare Part A and Medicare Part B only. Medicare Part A is classified as hospital insurance. It covers hospital stays, skilled nursing facility care, hospice, and some home health care services. Part A can be premium free, meaning you will not pay anything monthly to get care or get coverage, excuse me, if you or your spouse paid Medicare taxes for a certain amount of time while you were working. Most people don't pay a Part A premium because they did taxes while they were working. But if you did not pay Medicare tax, you most likely do not qualify for premium free Part A. And the amount that you pay per month for your premium is based on how long you paid into Medicare taxes. Medicare Part B is the other part of original Medicare. It covers outpatient care, certain doctor services and testing, home health services, durable medical equipment and supplies, preventative services, and certain outpatient prescription drugs under limited conditions. For the most part, if you receive preventative services from a Medicare provider, you will not have to pay out of pocket for that care. With Medicare Part A and B, you're going to be responsible for a yearly deductible, and usually you pay 20% of coinsurance for approved services you receive. So the unfortunate thing is that there is no yearly limit on what you pay out of pocket for services under original Medicare. The premium amount, so again, that amount that you're going to pay monthly in order to have coverage for Part B is based on your modified adjusted gross income on your taxes from 2 years ago. So it's a little bit confusing, but I'll give you a quick example. So for your 2021 tax return, that's what's going to be used to determine your 2023 Part B premium. Most people are going to pay the standard Part B premium, and that gets set every year. But if your past tax return is over that established limit that that Medicare sets every year, you may have to pay an extra charge to your premium. So the limit for 2023 for a single beneficiary is $97,000, and the cap for married people filing a joint tax return is $194,000. So if you're making more than those amounts, then you will have to pay a larger premium for Medicare Part B. But the standard premium for 2023 is $164.90 per month. Medicare Part D provides coverage for prescription drugs. There are specific Medicare-approved private plans that you can choose to enroll in for your prescription coverage. Each plan available may differ in the drugs that are covered as well as the cost. Medicare D premiums will depend on the plan that you choose. And in order to enroll in a Medicare Part D plan, you have to have Medicare Part A, and Part B. So to get D, you must have A and B. Part D plans use formularies, also called drug lists, to categorize medications and to structure your prescription benefits. All of the medications that are on that drug list fall into a tier, and then that tier the medication falls into corresponds with its cost. Everyone with Medicare, regardless of their income, health status, or prescription medications, has access to enroll in Part D coverage. If you don't have any other drug coverage when you enroll in Medicare, you should go ahead and purchase a Part D plan, even if for some reason you're not taking prescription medications at that time. So Medicare Advantage plans are considered all-in-one or bundled plans. So now we're talking about Part C. I know that's a little bit confusing because seems like we've gone out of order. We've talked about Medicare Part A, B, we went to D, and now we're going back to C. But that is because Medicare Part C plans or Medicare Advantage plans bundle all together. So they bundle Part A, B, and D together into one plan that's offered by Medicare-approved private insurance companies. These plans still are required to follow Medicare's coverage rules, but they also sometimes offer additional benefits that are not typically covered under original Medicare. So these plans can offer vision, hearing, dental coverage. Some offer transportation, some offer coverage for over-the-counter drugs, as well as some offer services that promote health and wellness like gym memberships. With these plans, you're still enrolled into the Medicare program, and you still have the Medicare rights and protections just like you would if you were enrolled in original Medicare. These plans offer customized benefits to people who have specific conditions and people who are chronically ill. Out-of-pocket costs, including your monthly premium, can vary between the Medicare Advantage plans. So Medicare pays a fixed amount to your Advantage plan each month to pay for your care. So you're still getting Medicare benefits, they're just being given to you in a different way. They're being administered by a private company versus Medicare itself. Advantage plans also have a yearly limit on your out-of-pocket costs for services. Once you've met the limit, services are going to be covered at 100%. Your out-of-pocket costs can be lower with an Advantage plan versus original Medicare. There are some drawbacks, however. You may need referrals to see specialists, or you may need to use specific providers or facilities within the plan's network. And with an Advantage plan, you are unable to enroll in a Medigap plan. Usually, most Medicare Advantage plans include prescription drug coverage. However, if you are in an Advantage plan that does not offer prescription drugs, you can enroll in a separate plan, so in a separate Part D plan. But if you enroll in a separate drug plan while you have prescription drug coverage through your Advantage plan, you will be disenrolled and put back into original Medicare because that's a no-no. You will not have the same plan options wherever you are. So they vary by area. And just like a regular commercial health plan, you will have a different network and different covered medications with each different plan. So I briefly mentioned Medigap plans on the last slide, but Medicare supplemental insurance, it's also known as Medigap. It helps to cover the remaining costs that you have after original Medicare pays. So those co-payments, co-insurance, deductibles I mentioned before, the Medigap plans are going to help pick up the cost of those. So to enroll into a Medigap plan, you have to have Medicare Part A and B. Medigap plans are not the same as Medicare Advantage plans, and it's actually illegal for someone to try and sell you a Medigap plan if you're enrolled in Medicare Advantage. Your monthly premium for a Medigap policy is going to vary depending on the policy you choose. Again, these are not through Medicare itself. These are private companies that offer these plans, but they are all Medicare sanctioned, Medicare approved plans. Some Medigap policies also cover services that original Medicare does not. Like some offer medical care when you travel outside of the US, and they'll cover the cost if you're traveling. When you have a Medigap plan, Medicare pays its share of the Medicare approved amount for covered healthcare services. And then your Medigap insurance coverage comes in and covers what's left. There are limits, however, to when you can purchase these plans because they're subject to exclusions for pre-existing conditions. So it's best to sign up when you're first available. When they're first available, you're first eligible for Medicare, because at that point it's guaranteed issue, and they're not going to be able to disqualify you or limit your benefits due to a pre-existing condition. There's more information on the Medicare website about when you can and cannot enroll or purchase a Medigap plan. And if you have questions about this, I encourage you to look at the website. It's medicare.gov. And there's a lot of really important information on there because there are some technicalities with Medigap plans. I just want to make a couple of quick notes about eligibility for Medicare when you're still employed. So if you or your spouse are still working, Medicare does operate a little bit. And whether or not you need to sign up for Medicare when you turn 65 depends on a couple of different factors. So it matters how you get your health insurance now. So who's delivering your current coverage, as well as the number of employees that are employed by the company where you or your spouse works. So typically, if you have job-based health insurance through your or your spouse's current job, you do not need to sign up for Medicare while you or your spouse are still working. You can wait to sign up when you or your spouse stop working, or if you lose that health coverage. So if you're still working and you want to keep your group health coverage that you have through your job, speak with the human resources department or your benefit administrator just to double check and make sure that everything's good with making that decision, as well as they can help you walk through when's the appropriate time to enroll in Medicare. There are some special rules when it comes to Medicare eligibility and enrollment. You can enroll in Medicare Part B without buying Part A. But if you buy Part A, you must also enroll in Part B. I know there's so many rules. I'm going to give you these slides so you have them to refer back to as well. I know there's a lot of rules and technicalities. As well, you're eligible to enroll in Medicare Part D if you have either Part A or Part B. And you cannot enroll in a Medicare Advantage plan or buy a Medigap policy unless you are enrolled in Medicare Part A and B. So let's talk about enrollment. When you first become eligible for Medicare, you have 7 months to make the decision to sign up to enroll. It is called the initial enrollment period. And that period begins 3 months before you turn 65, the month of your 65th birthday, and it ends 3 months after you turn 65. So that's the 7 months surrounding your birth month. During this initial enrollment period, you have the option to enroll into Original Medicare with or without a Part D plan or into a Medicare Advantage plan. So if you're under 65 and newly eligible for Medicare because of a disability, you have that initial 7-month enrollment period where you can choose your Medicare coverage 3 months before the 25th month of receiving benefits and ends 3 months after the 25th month of receiving benefits. So 3 months before you've been on it for a couple of years and 3 months after you've been on it for a couple of years, after you've been receiving those benefits. If you enroll in coverage during the first 3 months of your initial enrollment period, then your coverage will start the first day of the month that you turn 65. So we've talked about the initial enrollment period. Now let's talk about the yearly open enrollment period. Normally that is from October 15th to December 7th, which is why it's a great time to be having this conversation now. We're in the middle of open enrollment. So this open enrollment period allows you to make changes to your existing Medicare coverage. This is an opportunity to review your current plan to see if there may be a better option, or maybe there's a new plan on the market that has more features that you could utilize. Just a good time to kind of take stock of what you have and what is available. Any changes that you make to your Medicare coverage during this enrollment period becomes effective January 1st of the following year. So anything during October 15th to December 7th of this year becomes effective January 1st, 2023. So during this Medicare open enrollment period, you can change from Original Medicare to an Advantage plan. If you're in an existing Advantage plan and you want to get out of it, you can change back to Original Medicare. You can switch your Medicare Advantage plans. If you're in one, you want a different one, you can swap. You can join a Medicare Part D plan if you're not already in one. You can change your Medicare Part D plan if you don't like the one you're in, or you can drop your Medicare drug coverage altogether if you have an alternate form of drug coverage. So talked about initial enrollment. We've talked about open enrollment. There's also a general enrollment period. Not confusing at all. There's so many enrollments, and there's just a side note. There's actually some legislation that's floating around there. Nothing's been passed, but there's some legislation floating around that is proposing some changes to the open enrollment periods and how you can apply for Medicare. So we may be seeing some changes in the next little bit in terms of how all of this enrollment is structured. So just keep an eye out for that. Hopefully it'll go through because it is a little bit confusing. So the general enrollment period is from January 1st to March 31st of each year. If you did not enroll in Medicare during your initial enrollment period, so when you were first eligible, you can enroll in coverage at this time. So if you have a Medicare Advantage plan now, or if you have a Medicare drug plan now, you can also swap or switch them at this time. However, if you do make changes during this time, that coverage is not going to become effective until July 1st of that same year. Changes you make during this plan enrollment can be a little bit more limited. So if you're in a Medicare Advantage plan, you can switch to another one, or you can change to original Medicare and join a Medicare drug plan. During this enrollment period, you are unable to switch from original Medicare to an Advantage plan or join or switch a Medicare drug plan if you are in original Medicare. On top of the three we have already talked about, there is a fourth potential option for enrollment into Medicare. It is a special enrollment period. These don't happen a lot. They're probably the least utilized option for enrollment into Medicare, but we still need to kind of discuss it because it could be your situation. In order to be given a special enrollment period, you have to meet certain guidelines set forth by Medicare. If you did not join Part A or B during your initial enrollment due to having job-based coverage through your own job or your spouse's job, you will qualify for a special enrollment period whenever you decide to enroll into Medicare. You can use your special enrollment period and enroll into original Medicare anytime while you're covered under a job-based plan or during the 8-month period you have once your employer coverage ends. So if you don't enroll during the 8-month enrollment period that you have after your job coverage ends, your next chance will be the general enrollment period. So that second enrollment that we talked about. You may be eligible for a special enrollment for other reasons, such as a recent move. You might be able to switch Medicare Advantage plans or drug plans. Like we talked about earlier, your options are limited for Medicare Advantage plans based on where you live. So if you're moving to a different area, your network is going to change and you're not going to be able to utilize those same physicians. So you'll want to switch into a different plan that actually covers the physicians that are in your area. Some other possible circumstances that may make you eligible for a special enrollment period include if you lose your current job-based or health coverage, if your current plan changes its contract with Medicare and you no longer want to be a part of it, or if you receive a notice of error from Medicare or your plan that somehow your enrollment did not go through or was incorrect. The time frame for a special enrollment period and the effective date of your new coverage varies depending on your circumstances and how you qualified for your special enrollment. If you decide not to enroll into Medicare during your initial enrollment period and you don't meet any of the conditions for a special enrollment period, you may accrue a late enrollment penalty fee. If you must buy Medicare Part A because you didn't qualify for the premium-free Part A and you did not do so during your initial enrollment period, your monthly premium is going to go up 10% for double the number of years you didn't have Part A. So, for example, if you were eligible for Medicare Part A for 3 years, but you did not enroll into it, you will have to pay a higher premium, so 10%, for a total of 6 years. So that 10% gets tacked on to what the Medicare premium is for that year for 6 years if you did not sign up when you were eligible and you waited 3 years to sign up. If you did not enroll in Medicare Part B during your initial enrollment period, your penalty will increase by 10% each full year that you go without coverage for Part B. And this penalty lasts as long as you have Medicare Part B. So this can add up quickly. So for a quick example of that, your initial enrollment period, say it ended December 2020, but you did not enroll into Medicare Part B until the general enrollment in March 2023. So you've spent almost 3 years. Your coverage is not going to start until July because you used the general open enrollment period. So you went 2 full years without Part B coverage. So your Part B premium penalty is 20% of the standard premium. So you will pay that for the entirety of having Medicare Part B coverage. So it's really, really important to pay attention to those dates and make sure you're signing up when you're eligible if you do not have other coverage. If there is a period of 63 days or more after your initial enrollment period that you do not have Medicare Part D or other creditable drug coverage, you will be penalized for late enrollment. And the cost of the late enrollment penalty will depend on how long you went without Part D or other drug coverage. And that, again, will last as long as you have Medicare drug coverage. It's calculated by 1% of basically an average of what people are paying for Medicare Part D. It's a little bit more complicated since there's no standard plan for Medicare Part D, and those are more like commercial plans. So it's 1% of the average of the average premium of those plans for every full uncovered month you did not have Part D. And the monthly premium is rounded to the nearest 10 cents and added to your monthly Part D premium. So again, that base premium, that average, that's going to change every year as the policies change, and that will affect the penalty amount that you pay. So again, just like with Part B and really Part A as well, so important to pay attention to the time, the deadlines for when you are eligible to apply, because the penalties for not enrolling into Medicare when you're eligible can really start to add up. So how do we enroll? So to apply for Medicare Part A and B, you enroll through the ssa.gov website. So it's through the Social Security Administration. And you will be enrolled in Medicare Part A and B unless you choose a different option. And you can enroll in Part D, a Medigap policy, and a Medicare Advantage plan. And there's also ways to search your options on the Medicare website. Once you choose a Medicare drug plan, you can apply for prescription drug coverage in a few different ways. You can actually enroll on the Medicare Plan Finder, so that tool I was just talking about, on the plan's website by completing a paper form that you can ask to be sent to you. You can call the plan directly to enroll, or you can call 1-800-MEDICARE and enroll that way. When you join a Medicare drug plan, you'll give them your Medicare number and the date your Part A or Part B coverage started. They'll need that for the application, and that information can be found on your Medicare card. So talking a little bit more on what we need to consider and look at when we're choosing a plan and deciding what might be right for you. Make sure you understand what the plan's going to cost you in total, including premiums, deductibles, and other out-of-pocket costs. There can also be other specific coverage rules that can affect what you pay. Make sure the plan covers the services that you need. I mean, that's it seems simple, but there's tons of times when people enroll in plans not realizing that the care that they really need is uncovered. So all Medicare plans are going to cover services that original Medicare covers, but some plans like Medicare Advantage plans, like we talked about, are going to have extra benefits that you can utilize. Make sure your current providers and other facilities accept the plan that you choose. Again, if you're choosing a Medicare Advantage plan. If you have original Medicare, you can basically go to any provider or facility as long as they accept Medicare. If you choose an Advantage plan, you are most likely going to have a network of providers to choose from. So that's a set list of providers that have contracted with your plan to provide services to you. Sometimes you may also have out-of-network benefits to allow you to get services from a provider or facility that is not contracted with that plan. But generally, if you do go out of network, you're going to pay a higher cost. You'll also want to check the plan's drug formulary to see if the coverage is offered for your current prescriptions. Drug formularies, like we talked about earlier, can vary by plan, but all plans must offer a standard level of coverage that is set by Medicare. And lastly, make sure that you take the necessary time to choose your plan wisely and understand what plans are actually available to you. It's really important to understand what plan fits your health needs and what costs that you may incur when you choose a Medicare plan. This is just a little chart that kind of goes over a couple of things to consider when you're looking at enrolling in original Medicare versus Medicare Advantage. So I know we've talked about a lot of this before, but I just kind of want to drive the point home. Original Medicare does not have an out-of-pocket maximum, meaning there is no cap on what you can spend for healthcare services. However, Medicare Advantage plans do offer that. Medicare Advantage plans offer prescription coverage where original Medicare does not include drug coverage, and you do have to purchase that prescription drug coverage separately. Medicare Advantage plans have a smaller, sometimes limited network of providers, where with original Medicare, again, you can go anywhere as long as that provider accepts Medicare. Original Medicare offers no coverage for hearing, dental, or vision, where Medicare Advantage plans often do cover those services. And original Medicare offers consistent coverage for health services. Anybody on original Medicare around the country is going to have coverage for the same services, while Medicare Advantage plans do have the opportunity to change coverage with each plan year, and they can even change a drug list in the middle of a plan year. So some considerations specifically for acromegaly patients. I know that having specialists in network is sometimes a barrier to care in your community, and that is something that needs to be thought out when you're choosing a plan. So you will have a larger network of providers with original Medicare. However, you will most likely need to make a cost versus coverage choice. So with Medicare Advantage, you will have a more limited network but lower cost. And with original Medicare, you will have a much, much wider network, but with no cap on cost. So you also need to be aware that not only doctors, but also other providers are part of a network. So when you're looking at Medicare Advantage, are there hospitals, standalone clinics, labs, anything like that where you receive care that you want to continue using? And that's something you need to weigh because those may not be part of a Medicare Advantage network, and you may want to look at Medicare, original Medicare in that case. Copayment and cost. Since there's a lot of specialized care that's needed for acromegaly, the whole question of cost caps also comes into play here. So when shopping for a plan, you should look at the out-of-pocket maximum that's offered by a Medicare Advantage plan versus maybe not having all your preferred providers if cost is more of an issue. Lastly, prescription drug coverage should be closely reviewed. So take a closer look at the formulary, that drug list that we talked about, as well as the covered medications on that listing. So for Medicare Advantage plans, you will want to look at whether there's a separate drug deductible from your medical deductible. So some have separate deductibles you have to meet before your plan starts to pay. As well, each plan also has a list of preferred pharmacies. So make sure that the pharmacy that you prefer and that you choose to use is in the network. And that's either for Part D or for a Medicare Advantage plan. So make sure that pharmacy that you prefer is in network with the plan that you pick. So actually looking at what coverage is available and to find what plan may be best for you, there's a really great tool on the Medicare website, and you can compare them side by side based on what's offered in your area. There's a good tool, like I said, on the Medicare website to compare multiple plan options at once, and it allows you to search if your providers are in the network, as well as for prescriptions. So you can check for your current prescriptions and possible costs that might be associated with them. And another tip I would suggest is if there are medications that you think at some point you may be prescribed or are even alternatives to what you're currently taking, just take a quick peek, search on there and see if those are covered and how. And the Medicare website also offers a search for Medicare Part D and Medigap plans. If you're unsure about how to enroll or you're overwhelmed with all the options that are available to you, you do have a couple of options for guidance with the whole process of figuring out your plan and enrolling. And the first is the State Health Insurance Assistance Program. These programs give you one-on-one advice and assistance to you, your caregivers, your family, anybody that's weighing in on making this decision. There are tons of trained professionals, and they're a really great resource to help guide you through the process. As well, you can always reach out to Patient Advocate Foundation. I mentioned that team of case managers that we have. They are experienced with Medicare enrollment and helping you weigh your options. You can reach out to us at 800-532-5274 or our website at patientadvocate.org. So on that site, there's an online portal you can fill out to request help. So once you've picked a plan, once you've signed up for Medicare, you will receive a Medicare card. Whether or not you signed up for an Advantage plan, you will still get a Medicare card. It's mailed to you in your welcome packet. And you can also log in or create your Medicare account if you want to print it off and just have it before you get it in the mail. This card has a Medicare number that is unique to you. It used to be your Social Security number for privacy and identity protection. They're no longer doing that, so that is now a unique number. This card is often referred to as your red, white, and blue card, and it lists the type of coverage that you have and the date that that coverage began. If you're enrolled in Original Medicare, make sure you carry your Medicare card with you and give it to any doctor, treatment facility, or healthcare provider that you're seeing. As well, if you have Medicare Part D or any other supplemental coverage, carry that card with you. That is true as well if you have not only a Medigap plan, but if you're still working and you have employer-based insurance as well. There are some rules about who pays first in that situation, whether you're job-based insurance or whether Medicare pays first, and that's something that your treatment facility can work out, but you have to provide them with both cards so that they can do a little bit of research to figure that out. If you're enrolled in a Medicare Advantage plan, you will not use your red, white, and blue Medicare card. You will receive a Medicare Advantage card. They'll give you that when you sign up. And you should still keep that red, white, and blue card safe at your house. Put it away somewhere you know you're not going to forget it and you know where it's at. And if you ever decide that you want to switch coverage, you know where it's at, you can have it and you can utilize the original Medicare card. So how do you actually use it once you have it? If you don't know what's covered, you can always check to see if a test, an item, or a service that you need is covered. Medicare has a search tool, or you can call them. Again, it's 1-800-Medicare. But if you have Original Medicare, it's considered fee-for-service, as I've mentioned. So you can go anywhere, and as long as they accept Medicare, you can get care at that facility. But there are some things that Medicare does not cover. So if you want to receive these services, you will pay for them out of pocket, or you will need to have other coverage that will cover them. So some things that are not covered, we talked about long-term care and custodial care, most dental care or dentures, eye exams specifically to prescribed glasses, cosmetic surgery, acupuncture, hearing aids, and routine foot care are not covered. But again, if you don't know if something that you need is covered, you can go to medicare.com/coverage and check it out to see if it's going to be covered or not. Usually, you may be able to talk to your healthcare provider about the services you need, and if they are covered, they should know if they're a Medicare provider. Usually, if your provider recommends a service or treatment that is normally covered by Medicare, but they, for whatever reason, feel like it might not be covered in your specific situation, you will be required to sign a notice. It is called an advanced beneficiary notice of coverage, sometimes called an ABN. And basically that ABN states that you will have to pay for the service if it is not approved by Medicare. So how to know if your doctor accepts Medicare? You will need to double check if your doctor or healthcare provider accepts Medicare before you get treatment. If you have original Medicare before you get services, ask your doctor if they charge the Medicare approved amount. If they do, you will not be billed more than the standard Medicare deductible and coinsurance. So basically you end up paying less out of pocket. If they do not charge that amount, they can charge you more. And they may require you to pay that full amount at the time of service. So you may be asked to pay right when you get that care versus being billed for it later. If you have a Medicare Advantage plan, call your plan to see if they have a network listing and if your provider is in network. Usually to get in touch with them, just like on a regular commercial health insurance card, you're going to see the phone number on your card, on your health insurance card. Usually it's on the back. It'll say member services or patient services or something like that. There'll be a phone number listed next to it, and that's who you need to reach out to for customer service to find out if you have a network and who is in it. Some plans, like I mentioned before, allow you to use providers out of network, but generally in those cases, you are going to have to pay more out of pocket. You can always get emergency care and urgent care if you need it, even if the doctor or hospital is not in network, but just be sure to notify your Advantage plan that you have gone out of network, or if you think you have, as soon as you can, so they can start processing those claims correctly. If you have a Part D plan, check with your plan to find out what pharmacies are in network in your area. You can normally look that up online or by calling the plan. Again, that number is going to be on the back of your card. In-network pharmacies are preferred, and normally they're going to offer the lowest price for medications. And if you do use a pharmacy that is out of your network, you will likely have to pay more. Lastly, if you need assistance paying for Medicare, there are some programs that may be available to you to help kind of offset some of those costs. And the eligibility for these programs are going to be based off of household income and resources. The first is the Qualified Medicare Beneficiary Program, also called QMB, that helps pay for Part A premiums if you have to purchase it, Part B premiums, as well as any deductibles, coinsurance, and co-payments that you may have. This is the most comprehensive assistance program that Medicare offers. The next is the Specialized Low-Income Medicare Beneficiary Program. So many words. It is also called SLIM-B, and that program helps cover Part B premiums. And the Qualified Individual Program, or QI program, can also help pay Part B premiums. That program is run a little bit differently than the SLIM-B program. It's a first come, first serve basis, so it's a little bit harder to get assistance through that particular program. Lastly, the Qualified Disabled and Working Individuals Program, or QDWI, helps to pay for Part A premiums if you are a working disabled person, or if you lose SSDI and premium-free Part A when you go back to work from being on disability. I know with time constraints, we've been able to provide just a high level overview. There's a lot more to Medicare that we didn't get to discuss. We do have a 7-module Medicare training series if you want to review that and learn more. And you can also reach out to us at patientadvocate.org if you have questions about your specific situation to get a free case manager who can help you answer questions or walk you through the process. And as well, you can always reach out to me. My email is emily.brown@patientadvocate.org. Thank you for having me on.
Thank you, Emily. What a wonderful discussion that we have here. I also want to mention that you will be online for about 15 more minutes or so, and we will take questions within the chat box for question and answer session. And then after you finish, we will have a brief word from our sponsor. So thank you very much. And, let's get those questions rolling. Thank you, Emily. I actually have a couple of the questions that were sent in to me, and I'll go ahead and I'll read a couple of those. What do you suggest, Emily, if you look on every single one of the formularies for, we live with rare disease drugs, and you can't find one that covers our condition? What would you suggest?
Sure. So I would say to choose the formulary that covers the most drugs that you are prescribed. There are options for getting medications that are off formulary, so medications that are not listed as covered on the drug list. You may be able to go through the appeals process. So Medicare has a formal established appeals process. It's a 4-step process that you can go through. Your physician has to provide some information. You have to provide some information. But it is a formal written appeals process. We actually have a lot of good information about appeals on our website, as well as a module training, just like we have for Medicare, that can walk you through that process. Really, you just kind of need to explain why it's necessary to have access to the medications that are not listed on the formulary. You may also be able to request what's called a formulary exception. It's similar to the appeals process, but there is a more formal way. Again, your doctor or healthcare professional can kind of help with that process, because typically they have to provide a lot of medical information for why it's necessary for you to have a medication that isn't covered. But typically at that point, if you were able to get that approved, then that would be covered on the tier that other comparable drugs would be covered on. Great question.
So I just want to remind, if anyone has any questions, type them into the little chat box at the bottom of the screen. I do have some more that were sent in to me, though. Will Medicare cover me if I travel outside of the US?
So that's a wonderful question. Most likely no. It will cover, I believe, in US territories. But as far as international travel, you would most likely want to purchase a travel plan or an international plan. If you do go with a Medigap plan, then you would potentially, based on which one you buy, have additional coverage through your Medigap plan. Sometimes they offer some extra benefits for travel.
So someone just put in here, it said that one of the care programs is no longer available. And they want to know that they are starting Medicare September 1st. Do you have any suggestions for financial help other than the programs that you had named? And I'll send you
Judy H. If you're registered, I'll send a copy of the slides with all of the programs available, but see if she has any other.
Yeah, actually, one program that I did not mention, it's through the Social Security Administration. It's called Extra Help, and it is sometimes available for patients who need extra help with costs as far as prescriptions go. So that changes every year in terms of your eligibility based on income and resources. So I encourage you, even just a quick Google search, the title of the program is Extra Help. It is the Social Security Administration program. There's an application process, and you can kind of go through that. If you are eligible for any of those programs that I kind of mentioned that help with premiums and deductibles, you would most likely be eligible for Extra Help as well. But it is an application process that you would need to go through and look at the eligibility.
Okay, another question. Do I automatically receive Medicare if I qualify for disability benefits?
So yes, but you do have that 25-month waiting period. So disability is a little bit tricky because there are two types of disability programs. So with SSI, you get Medicaid. So SSI is typically for low income or for folks who have not worked or paid into Social Security taxes. Most people who have had a more consistent work history or have paid into Social Security taxes are on a program called SSDI, Social Security Disability Insurance. And that your payment for that is calculated based on what you've made while you were working. But with that program comes Medicare, but there is a waiting period of 25 months. That doesn't mean that you have to be on Medicare for, you have to be on disability for 2 years. There is a, it's the date that you are deemed disabled. It's a little bit confusing, but when you get approved for disability, Social Security gives you a date that they recognize as the date that you became disabled. So it could be before you even applied. Usually that does happen for a lot of folks. People are sick for a long time before they apply for disability. So typically Social Security will go back to that date, well, a year. They count back a year. So you can get on Medicare after, I'm sorry, I'm trying to explain this in a way without showing you a chart. You can get on Medicare without actually waiting those 2 years after your disability starts. So I know that was not the most clear answer, but yes, it comes with SSDI.
So if I retire at age 62, can I receive Medicare?
You still have to wait for age 65. You would need to find some other coverage, whether that's your spouse coverage or extended coverage. Sometimes employers offer that extended coverage through your job as a retirement benefit, or looking to the health insurance marketplace for coverage to kind of tide you over those 3 years.
Okay. If I have TRICARE, do I need to have Part D coverage?
That is a great question, and I am not a TRICARE expert, so I will bow out of that, but I can certainly send you an email after I've done a little bit of research. We don't actually work with a ton of TRICARE patients at PAF. We welcome them, but we just don't get a lot of experience working with TRICARE patients. Typically, they are able to be assisted by TRICARE representatives.
So this kind of goes on the same. How does Medicare work for veterans? Do they join Medicare just like anyone else, or do they?
Yes,
do
they
the-
can. And then TRICARE and Medicare can work together as far as costs are concerned.
Okay. And I think this is the final one that was sent to me previously. Can I have COBRA and Medicare at the same time?
So there are some very specific rules about coverage. I kind of mentioned that a little bit in my presentation. When you are working or if you have job-based coverage as well as Medicare, it all depends on how many employees are at the job that your job-based coverage is from. So there's a wonderful chart on the Medicare website. And it tells you who pays first in which situation. So sometimes based on the number of employees at the job your insurance is sponsored by, if it has a certain number of employees, then they pay first, or if it has below that number, then Medicare pays first, and then they act as the supplement. So it can kind of get confusing as far as the coordination of benefits for COBRA and Medicare. But there's a really nice chart that helps explain all that. And if you have questions about who pays first, that's a great chart to refer to, or just to call Medicare themselves, 800 Medicare.
Well, thank you so much. And if there's no other questions, I think that we will say goodbye, Emily, and we appreciate you. And next is a word from our sponsors. Please stay
Thank
on and
you
listen to
so
a word from our
much.
sponsor. Thank you.
Hi, I'm Lisa Nelson, Head of U.S. Corporate Affairs at Amrit Pharma. Thank you for taking the time to attend the Acromegaly Community Insurance Education webinar. Amrit Pharma is proud to sponsor this event in order to enhance the community's understanding of how best to navigate insurance basics and overcome potential barriers to care. Over the last few years, the complexity of accessing medicines has only increased, placing additional burdens on healthcare professionals and patients to effectively navigate the system to get the medicines they need. Since 2016, Amrit Pharma has been serving rare disease patients around the world and has delivered an oral treatment for acromegaly to patients in the U.S. since 2021. With an exclusive focus in rare diseases, we are able to provide a comprehensive and personalized approach to everything we do. Whether that's the basics of navigating prior authorization and financial assistance, or ensuring that each patient receives their medication in advance of a natural disaster, we are here to help. We know that living with acromegaly comes with both physical and emotional burdens, and we aim to make it easier for you to get the treatment that you need. We believe in open access for patients and their physicians to decide what therapy is best suited for their individual situation. We hope that you've taken away knowledge during this session that will better prepare you for open enrollment in the coming weeks and will allow you to navigate barriers in coverage and access as they arise. You can learn more about Amrit Pharma by visiting our website at www.amritpharma.com. Thank you.
And thank you for joining us this evening. I do hope that this will help a lot of you understand the way that Medicare works and that you can use this information to help yourself. I will be sending out, copies of the slides and also some handouts to all of you that have registered. And if you're not registered, just reach out to me individually. My contact, Jill at acromegalycommunity.org, and I will be sure and get those items to you. Thank you very much and have a great night, everyone.